All right, welcome back to our series on Achilles tendinopathies. This video just wanted to give you a little bit of a rundown of how to sort of give yourself a bit of an assessment as to whether your injury may or may not be an Achilles tendinopathy, but it is really important that you know if you do suspect you do have one, it is best if you check in with your GP or your healthcare provider just to follow up, because these injuries can very easily become chronic and prolonged. So first of all, a little bit of what is an Achilles tendinopathy. So they used to be called Achilles tendinitis, so you might have also heard that term thrown around, but in recent medical research they've actually found that inflammation does not play a main role in the pathology of this injury. It's more of a degenerative process where chronic overuse has led to disorganization of fibers and degeneration of the tendon structural integrity. Tendinitis referred to inflammation of the tendon. Itis means inflammation, so now it's referred to as a tendinopathy or a tendinosis. Just a little bit of pedantic on the terminology, but so you've got three main phases of tendinopathies in general. First phase is reactive tendinopathy, and that's where there's acute swelling, pain. This might have sort of come on relatively recently, and if you don't rest and recover or treat it appropriately, it will go into phase 2, which is tendon disrepair, and this is where the tendon structural integrity starts to be compromised. The collagen fibers start to misalign. You may start to get like a little bit of thickening of the tendon as well. Eventually, if this isn't taken care of at this stage, you can progress into stage 3, a more degenerative tendinopathy, and this is where the collagen fibers are quite disorganized. There's also ingrowth of more blood vessels and nerves, making the area more sensitive, and it's just more prone to injury or rupture. So you want to try to avoid catch you at any of those stages, and try to avoid any further degeneration. So make sure you check in with your doctor if you do suspect you have something like this. So how do you tell if you have a tendinopathy? So clinically we use a combination of like taking a case history, also observation of the tendon, and palpation predominantly. So first of all, we'll talk to you about how it came on. So if the onset was more gradual, typically that's sort of indicative of a tendinopathy, compared to if you had an accident or you're playing sport and you felt a pop or a tear, and then had pain pretty soon after that incident, that's more likely to be a tear or like a strain. So you want to treat that a little bit differently. But if it's sort of something that's come on, you've like increased your exercise load and you're just starting to feel this pain around the Achilles, maybe tendinopathy. Next is often there's pain worse in the mornings, so on your first steps. That's a very common feature, particularly in the reactive early phases of a tendinopathy, and your pain will also be exacerbated typically by running or jumping, those kind of movements that load up the tendon. If you compare to the tendon on your other side, assuming that doesn't have a tendinopathy as well, you often notice like a swelling or a thickening, so one will appear wider or thicker, and if you palpate it will feel thicker. On the affected side, if you squeeze the tendon at different portions, you'll probably find some very tender spots, and this is how we check in the clinic. We'll actually assess the tendon, palpating along. Usually there will be a very strong pain response from segments of the tendon within a few centimeters of the attachment to the heel. And I should say there are two main types of Achilles tendinopathy. There's mid-tendon tendinopathy, where the affected part of the tendon is within the tendon, 2 to 4 centimeters from the attachment at the Achilles, at the heel. This is the most common type, but there is also the insertional type, where the disrepair is at the insertion at the heel. So you'd have to palpate all the way down to the heel just to double check that. Both of those take slightly different approaches in terms of exercises, but we have very similar kind of approaches in treatment for those. So if any of this sounds like you, make sure you check in with your doctor or your healthcare provider, or if you're here in Sydney, give us a call or jump online to villageremedies.com and we'll see if we can help you out. We do have some other videos as part of this series walking you through the different phases of recovery to give you a bit of an idea of what kind of exercises and everything you'd be looking at. All right, I hope that helps. See you next video.